Welcome to OET Answers.
Occupational English Test. OET Answers Practice Test, Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. You hear a doctor talking to a patient called Mrs. Parker. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning, Miss Parker. How can I help you today?
Morning, doctor. I've been waking up with really bad headaches, and my jaw has been sore for the past couple of weeks. I thought it was just stress, but now it's getting worse, and I'm not sure what's causing it.
That sounds uncomfortable. Headaches and jaw pain can definitely be linked to stress, but let's dig a little deeper. Have you noticed any other symptoms?
Yes, actually. My teeth have been feeling kind of sensitive to cold drinks, which is new for me. I've also had some earaches recently, but I thought that might just be from sleeping in a bad position. The headaches are the worst though. They're right around my temples, and they start almost as soon as I wake up.
Given what you've described, it sounds like you might be grinding your teeth at night, a condition known as bruxism. It's fairly common and can cause all of the symptoms you're experiencing, like jaw pain, headaches, ear discomfort, and tooth sensitivity. Bruxism typically occurs unconsciously during sleep, but some people also grind their teeth during the day when they're stressed or concentrating.
Teeth grinding? I had no idea I was doing that. How would I even know if it's happening while I sleep?
It's tricky because bruxism often happens without people realizing it, especially during sleep. One way to find out is by asking someone you live with if they've heard any grinding or clenching sounds while you're sleeping. You might also notice that your jaw feels tight or tired in the morning, and over time, your teeth may show signs of wear or flattening. A dentist can usually spot these signs during an exam as well.
Now that you mention it, my partner has told me a couple of times that they've heard a grinding noise while I was asleep, but I didn't think much of it at the time. Is bruxism something I should be worried about long term?
It can definitely become an issue if left untreated, especially if it's severe or happens frequently. Chronic teeth grinding can lead to more significant problems, like worn down or cracked teeth, receding gums, and even damage to your jaw joint, which could cause temporomandibular joint disorder, TMJ. This can lead to persistent pain and difficulty moving your jaw. The good news is that there are ways to manage it and reduce its effects.
I didn't realize it could get that bad. What causes someone to grind their teeth in the first place? Is it just stress?
Stress is one of the main triggers for bruxism, but it's not the only factor. It can also be related to anxiety, sleep disorders like sleep apnea, certain medications, or even how your teeth align. Some people have a tendency to grind their teeth more when they're in a deep stage of sleep, and it can be influenced by habits like consuming caffeine or alcohol before bed. A combination of these factors can increase the likelihood of teeth grinding.
That makes sense. I've been under a lot of stress with work lately, and I've also noticed I've been drinking more coffee to stay awake during the day. Could that be making things worse?
Absolutely. Stress and caffeine can both contribute to bruxism. Caffeine stimulates your nervous system, which can make it harder to relax and can increase muscle activity while you sleep. Reducing your caffeine intake, especially in the late afternoon and evening, could help lessen the grinding. It might also be helpful to find ways to manage your stress levels, whether through relaxation techniques, exercise, or something like mindfulness or meditation.
I guess I'll need to cut back on the coffee. Is there anything else I can do to stop grinding my teeth? Do I need to see a specialist or a dentist?
Seeing a dentist would definitely be a good step, especially if the grinding is causing damage to your teeth. They can examine your teeth for signs of wear and may recommend a mouth guard, also known as a night guard, to wear while you sleep. This can help protect your teeth from further damage and reduce some of the pressure on your jaw muscles. Mouth guards are custom-made to fit your teeth comfortably, so you don't have to worry about them being bulky or uncomfortable.
A mouth guard sounds like a good idea. Is it something I'd need to wear all the time?
You'd only need to wear it at night, since that's when most people with bruxism grind their teeth. If you find yourself clenching your teeth during the day, you can practice consciously relaxing your jaw. Sometimes, people aren't aware they're doing it, so it might help to check in with yourself throughout the day to make sure your teeth aren't clenched together. Keeping your lips closed and your teeth slightly apart is a good resting position for your jaw.
I've definitely noticed myself clenching my jaw when I'm stressed or focused on something. I'll try to be more aware of that. Is there anything else I should be doing to manage this?
It should definitely make a difference. I'll also schedule a follow-up in a few weeks to see how you're progressing and whether the symptoms have improved. If the pain or discomfort persists, we can explore other options, like physical therapy for your jaw muscles, or even a referral to a specialist for further evaluation.
Extract 2. Questions 13 to 24. You hear a doctor talking to a patient called Mrs. Thompson. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, Ms. Thompson. I see from your chart that you've been experiencing a variety of symptoms lately, and I understand it's been quite a journey for you. I'm here to discuss your medical history and current condition in more detail. Is that all right?
Yes, definitely. I've been feeling so off lately, and it's been hard to figure out what's going on. I've seen my GP multiple times, but I feel like I'm not getting any better.
I can imagine how frustrating that must be. Let's try to piece everything together today. I see here that you've been experiencing fatigue, weight gain, and some hair loss over the last few months. Can you tell me a bit more about these symptoms?
Sure. I've been feeling unusually tired all the time, no matter how much I sleep. I've gained about 10 pounds in the last 3 months without changing my diet, and my hair seems to be falling out more than usual when I brush it. I also feel cold all the time, even when it's warm out.
That sounds really uncomfortable. Have you noticed any changes in your mood or memory?
Yes, actually. I've been feeling more down lately, and it's been hard to concentrate at work. I thought it was just stress, but it feels different, like my brain is in a fog.
I see. I also noticed you mentioned muscle aches and joint pain. Has that been ongoing?
Yes, my muscles feel sore, like I've done a hard workout, even when I haven't. My joints, especially my knees and wrists, ache sometimes, and it's getting harder to ignore.
Thank you for sharing that. I can also see that you've had some lab tests done. Your GP noted that your TSH levels were elevated, but it seems there wasn't a follow-up plan in place after that.
Right. My GP mentioned something about my thyroid, but I didn't really understand what it meant, and then I got busy with work. I figured I'd just push through, but it's getting worse.
Based on what you've described and your lab results, it's quite likely that you have hyperthyroidism. This means your thyroid gland isn't producing enough thyroid hormones, which are crucial for regulating your metabolism, energy levels, and overall bodily functions.
Oh, that makes sense. Is that why I've been gaining weight and feeling so tired?
Exactly. Thyroid hormones play a major role in how your body uses energy. When levels are low, your metabolism slows down, leading to weight gain, fatigue, and even changes in your mood and cognitive function.
I wish I had known this sooner. Is it common to have hyperthyroidism?
Yes, it's quite common, especially in women and as people get older. It can be caused by autoimmune conditions like Hashimoto's thyroiditis, where your immune system mistakenly attacks your thyroid, or it can result from other factors like iodine deficiency, certain medications, or even pregnancy.
That's interesting. I do have a family history of thyroid issues. My mother has it, too.
Family history is a significant factor, so that's important information. Let's discuss treatment options. The standard treatment for hyperthyroidism is a daily medication called levothyroxine, which replaces the deficient thyroid hormones. It's usually very effective, and most patients see improvement in symptoms within a few weeks.
That sounds manageable. Are there any side effects?
Side effects are generally minimal if the dose is correct, but it's important to monitor your thyroid levels regularly, especially at the beginning, to adjust the dose as needed. The goal is to find the right balance to alleviate your symptoms without over-replacing the hormone.
That's reassuring. I just want to feel like myself again.
I understand. We'll work together to get your thyroid levels back to normal. I'll also recommend some lifestyle changes that might help, like a balanced diet, regular exercise, and stress management techniques. These can complement your treatment and help improve your overall well-being.
Thank you, doctor. I really appreciate you taking the time to explain everything. I'm ready to start treatment and get back on track.
You're very welcome, Ms. Thompson. I'll arrange for your prescription and we'll set up follow-up appointments to monitor your progress. We're on the right path, and I'm confident you'll feel better soon.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear 2 colleagues talking about a problem. Now read the question.
The patient in room 12 keeps pressing the call button. He seems really anxious about his discharge plans.
Yes, I spoke to him earlier. He's concerned because he doesn't know when he'll be going home. No one's communicated the plan clearly.
That's understandable. He's been here for a while now, but I think his discharge depends on his care package at home being confirmed.
Has anyone from the discharge team discussed the plan with him yet?
Not yet. I think there's been a delay in arranging his home care.
We really need to let him know what's happening. I'll go have a chat with him now. Active listening and keeping him informed will help ease his anxiety.
Yes, and we should be mindful of how important clear communication is in reducing his stress.
Now look at question 26. You hear a healthcare manager sharing experience. Now read the question.
Our schedules, patient appointments, budgeting, on top of ensuring we provide the best patient care. It was overwhelming at first, but gradually I learned how to juggle both roles. I find that staying organized and planning ahead are essential. In fact, handling the administrative side has made me a better clinician because it helps me see how everything fits together, from patient care to clinic operations. My supervisor is always there for support if I need it, but he trusts me to handle things. I update him regularly, and he's happy when I find ways to streamline processes or reduce costs. It's definitely challenging, but I enjoy the broader perspective it gives me.
Now look at question 27. You hear a surgeon talking to a patient. Now read the question.
Now, Mr. Evans, before we move forward with the procedure, do you have any other concerns or questions that you'd like to discuss?
Well, I've been thinking quite a bit about the pain after the surgery. I know that there will be some discomfort, but I'm wondering, just how bad is it going to be?
It's completely natural to be concerned about post-operative pain, Mr. Evans. Rest assured, we'll manage it carefully to keep you as comfortable as possible. We typically use a combination of pain relief medications, tailored to your needs. In certain cases, we can also apply local anesthesia during the surgery itself, which helps to significantly reduce discomfort in the immediate hours afterward.
I'm just feeling uncertain because I don't know exactly what to expect. Will the medication really be enough to control the pain?
Yes, we will carefully adjust your pain medication based on how you're feeling after surgery. Our priority is to ensure you're comfortable throughout the recovery process. Managing your pain is an essential part of helping you recover well, so you won't have to worry about enduring unnecessary discomfort.
Now look at question 28. You hear a nurse talking to her colleague about a patient. Now read the question.
Okay, so the next update is about Mr. Evans in room 4. He's one of our hypertension patients, and we've set him up with remote patient monitoring to keep a closer eye on his condition.
Right, I remember. How's he been doing?
Well, his blood pressure has been fluctuating quite a bit over the past week, which is why he's now using a wearable monitoring device. This device sends us real-time data on his readings. His most recent blood pressure reading was elevated, about 156/92, but it's still considered within his normal range. He's also been participating in telehealth follow-ups to keep his treatment on track. He actually had a video consultation with the doctor earlier this morning, during which his medication dosage was adjusted accordingly. He's supposed to keep monitoring his blood pressure through the night, and we'll check the logs first thing tomorrow morning. Also, we need to replace the battery in his wearable device tonight to ensure it continues functioning properly. So let's make sure that gets done.
Okay, I'll take care of it.
Now look at question 29. You hear a nurse manager talking about innovations in nursing practice. Now read the question.
We've been talking about innovations in nursing practice, and I think it's time we start incorporating more evidence-based interventions in our daily bedside care.
Absolutely. The new guidelines suggest using those pressure-relieving mattresses for high-risk patients, don't they?
Yes, that's right. It's been shown to significantly reduce the risk of bed sores. But we also need to look at how we can adopt new technology to support patient monitoring more efficiently.
I agree. I've seen some interesting case studies on how remote monitoring has improved patient outcomes, especially in chronic conditions.
Exactly. If we can start using these tools more creatively, We can not only improve patient care, but also set an example for other departments.
Should we consider getting more input from our team to identify areas where technology can help?
Definitely. I'll bring this up in the next staff meeting and see what other suggestions come up.
Now look at question 30. You hear a poster presentation on long-term impact on COVID-19. Now read the question.
A poster on the long-term impact of COVID-19 with a particular focus on how it affects both cardiac and respiratory health over time. We conducted a comprehensive longitudinal study that included 50 patients who had previously been diagnosed with long COVID. These patients continued to experience persistent symptoms for more than 6 months, including issues like shortness of breath and frequent heart palpitations. Our findings revealed that around 35% of these individuals developed long-term cardiac complications, while approximately 45% experienced ongoing respiratory issues. One of the key variables we examined was vaccination rates. Our data indicate that patients who had been vaccinated generally experienced less severe and persistent symptoms compared to those who hadn't been vaccinated. With the continuous emergence of new COVID-19 variants, it's becoming increasingly important to adapt both our vaccination strategies and treatment protocols. Ultimately, these findings underscore the necessity of continued research into the long-term effects of COVID-19. This not only helps in improving treatment options for long COVID sufferers but also informs public health regulations to prevent further spread of the virus.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For question 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Extract 1, questions 31 to 36. You hear a doctor giving a detailed presentation on hamstring injuries. You now have 90 seconds to read questions.
My name's Dr. Michael Stewart, and I'm a sports physiotherapist working here in the clinic. Today, I'll be presenting on what many consider a difficult subject, addressing hamstring injuries with athletes. A hamstring injury is a complex and often misunderstood issue. It involves more than just muscle strain. Factors like muscle imbalances, poor flexibility, and inadequate warm-ups play a significant role. As a physiotherapist, I encounter these injuries frequently, but discussing the extent of the injury and rehabilitation process can still be challenging for both myself and the athlete, who may already anticipate bad news. This challenge arises because, as healthcare providers, we're often uncertain about how to communicate the severity of the injury, while still encouraging athletes in a way that keeps them motivated and hopeful. During consultations, our primary goal is to ensure the athlete understands their condition, but if we lack the initial communication skills to do so, we risk damaging the athlete's trust and confidence in the recovery process. Miscommunication can lead to unrealistic expectations, incomplete recovery, or even re-injury, all of which can severely impact athletic performance and overall health outcomes. So, how do we ensure effective communication when discussing injury management? Often, the first steps we take when initiating dialogue with an athlete set the stage for their understanding and commitment. Establishing the athlete's comfort level in discussing their injury is essential. I often begin by asking if they're comfortable talking about their hamstring issue and what they understand about their injury. Using specific but gentle language like muscle strain or soft tissue injury, instead of terms like tear or rupture, can help ease the athlete's anxiety and foster a trusting relationship. This approach is crucial in helping athletes feel less overwhelmed by the diagnosis. Another technique I use is focusing on the condition rather than the person. For example, instead of saying you're injured, I prefer to say your hamstring has sustained an injury. This subtle difference can make the athlete feel less defined by their injury and more like an active participant in the healing process. Once rapport is established, maintaining the dialogue with the athlete through open-ended questions is vital. These questions should be free of any biases or assumptions about their training habits or injury history. Let me illustrate this with an example. The key questions we use as physiotherapists often revolve around the primary factors influencing recovery: the athlete's training load, previous injury history, and adherence to rehabilitation protocols. If I say, you need to take time off, it sounds directive and can be demotivating. However, a question like, how do you feel about adjusting your training to focus on recovery, shows empathy and invites collaboration, allowing the athlete to take ownership of their rehabilitation journey. It's important to remember that sometimes, despite our best efforts, consultations may not go as planned, and setbacks can occur. In such situations, I advocate for linking the injury to the athlete's broader performance goals. Whether it's sprinting, jumping, or even day-to-day mobility, the general health of the athlete is always the priority. This technique, when used thoughtfully, can help athletes view their hamstring injury not as an isolated problem, but as a factor that, when managed properly, can lead to improved overall performance. When athletes understand the connection between recovery and their performance goals, they're more likely to stay committed to their rehabilitation plan. To reinforce the importance of compliance, providing educational resources, such as videos or handouts on hamstring injury management, can be very helpful. I often suggest setting 2 or 3 specific, achievable goals for the recovery period, like regaining a certain range of motion or completing a set number of strengthening exercises each week. This is also an opportune moment to gauge the athlete's readiness to engage in their rehab and to assess external factors, such as support from their coaching staff or teammates, which can be critical to their success. All the strategies I've discussed today fall under what physiotherapists refer to as collaborative rehabilitation. This approach is centered on guiding athletes from a state of frustration or denial about their injury to taking active steps toward recovery, with the healthcare provider acting as a facilitator rather than a dictator of the process.
Extract 2. Questions 37 to 42. You hear Dr. Helen Morris explaining about hair loss. Now read the questions. You now have 90 seconds to read questions.
Good evening. I'm Dr. Helen Morris, and today I want to delve into the topic of hair loss, a common issue that affects millions of people worldwide. We'll explore what we currently understand about hair loss, discuss effective treatments, and debunk some myths that often mislead people seeking solutions. So, let's dive right in. What causes hair loss? The leading factors include genetics, hormonal changes, medical conditions, and certain medications. The most common type is androgenetic alopecia, also known as male or female pattern baldness. It's largely hereditary and can start as early as your teens or 20s. Other causes include conditions like alopecia areata, an autoimmune disorder where the body attacks its own hair follicles, and telogen effluvium, a temporary form of hair loss often triggered by stress, illness, or drastic changes in diet. But here's the catch. Hair loss is highly individualized, and what works for one person might not work for another. There is no one-size-fits-all solution. However, the most effective approach often combines medical treatments with lifestyle adjustments. Medications like minoxidil and finasteride are commonly used to slow down hair loss and in some cases stimulate regrowth. But these are not miracle cures, and results vary widely. So, what's the confusion? Why do so many people feel overwhelmed when it comes to treating hair loss? One reason is the sheer volume of information and misinformation online. The market is flooded with products that promise to reverse hair loss overnight, from shampoos to supplements. But most of these claims are not backed by solid scientific evidence. Often these products are marketed by companies looking to profit off of people's insecurities, much like how the beauty industry has historically preyed on body image issues. For instance, many people believe that certain oils or natural remedies can stop hair loss. While some natural treatments can improve scalp health, there is little evidence to suggest they can halt genetic hair loss. Similarly, the idea that frequent hair washing or wearing hats contributes to hair loss is unfounded. These myths persist because they offer simple explanations and solutions that seem too good to be true, and they usually are. So, what does the evidence actually say? To date, the most compelling data comes from clinical studies on FDA-approved treatments. Minoxidil, a topical solution, has been shown to improve hair density in both men and women, although it must be used continuously to maintain results. Finasteride, a prescription medication for men, works by blocking the hormone responsible for shrinking hair follicles. However, like all medications, these treatments have potential side effects, and not everyone will respond to them. But let's not forget about the psychological impact of hair loss. It's not just a physical issue, it's deeply tied to self-esteem and confidence. Many people struggle silently, feeling embarrassed or hopeless. This is why it's crucial to seek professional advice rather than fall victim to misleading advertisements and miracle cures. A dermatologist or trichologist can help diagnose the type of hair loss and recommend a tailored treatment plan, which might include medications, low-level laser therapy, or even hair transplantation in more severe cases. We also need to talk about prevention, which often gets overlooked in the rush to find a quick fix. Maintaining a balanced diet rich in essential nutrients, managing stress, and avoiding harsh hair treatments can play a supportive role in overall hair health. While these measures won't necessarily prevent genetic hair loss, they can help create an optimal environment for hair growth and reduce the impact of other contributing factors. So, where does this leave us? The most important takeaway is that while hair loss can be distressing, there are scientifically validated treatments available that can help manage the condition. It's vital to set realistic expectations and be wary of sensational claims that promise quick fixes. Hair loss treatments require time, consistency, and often a willingness to try different approaches to see what works best.
That is the end of Part C. You now have 2 minutes to check your answers.